The big challenge with bulk billing today as we move into an environment where fewer and fewer GPs are bulk billing, it means that there's a particular challenge that those who are still bulk billing will face. And that is that the people who are seeking bulk billing will be the more difficult clients, more difficult patients. And that might be a generalization, but unfortunately, it's quite likely that lower socioeconomic status and inability to pay for private health to a GP, even though they're getting a rebate, means that they're going to have more medical problems, poorer diet, they might smoke more, they might drink, they might smoke at all. And these are more complicated patients. These are more difficult to manage compared to someone who's able to afford to pay for their GP consult. It's likely that they have more resources, better diet, better exercise, less toxins. Perhaps there's more stress, but they're also better patients often because they actually implement what we say as doctors. And so you've got this kind of separation going on of easier patients with money heading towards private GPs, able to pay, and the more difficult patients, as a generalization, I get it, but they're going to end up with bulk billing. And it means that if you're going to keep bulk billing, guess who's coming for you? You're going to have a deluge of these difficult, complicated patients, and the government's unwilling to pay for those. They're not increasing the amount of money that's coming for those difficult cases, which means, what are you going to do? It means like it's a tough decision. It's a tough decision. You get stuck there going, whoa, why is this so stressful, so difficult? Why are all my patients so hard? And in that case, the jump across to private billing becomes more of a necessity. It's not so much a choice anymore. It's like, you know what? I just can't deal with the complexity, the difficulty of these patients. All of them are coming to the bulk billing doctor and they are like, you know what, I don't want to do this anymore. So they either quit or they implement private billing. And so this is why it's likely now that as we've seen more and more GP practices move to private billing, that those that have not will also make that jump, which means a bigger problem's coming. It's like, well, where are these patients going to go? If most GP practices, the majority of GP practices you have to pay for, and there'll still be a percentage of population who cannot afford that, what do we do? Well, we could look to the models that exist already for specialist services. What are those? Well, there's outpatients, there's hospitals. And right now, all of those people, or not all of those people, a lot of those people are ending up in emergency. But the problem is that emergency is not really about general practice. We may well have to accept that the public hospitals institute GP services for free. And that this might make sense because it's still a whole lot cheaper to treat patients in a public outpatient hospital for GP services than it is for them to turn up in the emergency department or show up to medical services with significant pathology that should have been picked up 2 months, 2 years, a long time ago, not 2 decades. Hopefully they haven't had something but possibly. You know, it's possible that someone just had something that should have been picked up and instead they're presenting with these very difficult problems. So the state governments may not be able to kick it back to the federal government. They may have no choice because of what I've already said, that bulk billing in general practice is likely to get more and more difficult for those doctors that don't make the jump. And this is going to present a problem. It will present a problem. And the solution for the GPs is to start privately billing. And so the number of bulk billing doctors shrinks, but now there's this group of patients. It's like, well, what do we do? And maybe that's where these urgent care clinics are going to come in, but we've got another problem. Who's going to staff them? Who is going to staff these? We do not have that many GPs right now. And to be called across to that work, it better be well paid. And right now, it doesn't look that attractive compared to working in private practice and billing privately. So the urgent care clinics, the actual state governments, if they're going to do this, they're going to have to spend a fair bit of money. So someone's going to have to look at the cost of this and go, what do we do? What do we do? But if you are a bulk billing GP and you are seeing an increasing number of complex, difficult patients with many, many challenges, then perhaps you need to consider the move to private practice as well. Out of necessity, out of self-preservation. You get paid better. A lot of the junk medicine will stop. You won't be consulting about marriage difficulties or how to fix IT problems or various things that just go away when you start privately billing. All right, that's all I got for you. I hope if you got some value out of it, but it is likely that we will see less and less bulk billing because of this fact, because the fact that the more difficult patients end up going to bulk billing doctors and they're like, you know what, it's time to change. All right, that's all I got. One last little thing there. Look forward to seeing another episode as we finish up today. See you then.